Good morning. Today we are discussing chapter about the thalamus. Today now introduction thalamus. Thalamus. They are related by the anatomically and functionally the relations and the internal structure. The relationally they are going to the functions. The internal structure they have the gray matter, white matter. The anatomically there are the anterior side, medial, lateral nucleus. The functional there are the simple sensory wave nucleus, circular related nucleus, associated nuclei, internal medullary laminae. White matter there are internal medullary laminae, external medullary laminae. We have going to the thalamus. Thalamus is the largest part of the disocephala. That is the thalamus is the large ovoid mass gray matter situated at the bilateral of the disocephalum. Both thalamus have the 80% of side disocephalum. The thalami and the both side of connected their rostal portion of meaning of the intermediate mass. It's the large nuclear mass, the whole body, to form the two oval mass of the gray matter. It's the gateway of the sensory cortex. It's the gateway of the relation of sample head. The hence means egg because of the anterior traps. Together with the hypothalamus become the lateral wall of the third ventricle. It's related of the sense of the received information to the cerebral cortex. The axon from the every sensory system synapses of the thalamus. That is the lay of the last step. The information reaches the cerebral cortex. There is the thalamic nucleus receiving the input from the cerebellar nucleus, basal ganglion, and limbic brain regions. So this is the thalamus. Showing the picture, there are the thalamus, epithalamus, subthalamus, and hypothalamus. In the thalamus, that is the thalamus nucleus are classified into two methods: the anatomical classification and the physiological classification. The anatomical classification, the thalamus and each side is divided into 5 main nucleus. That is group of Y-shaped internal medial laminae. Internal laminae. That is the medial nucleus, interlaminar nucleus, medial mass nucleus, and lateral mass nucleus, and the posterior group of the nucleus. And there have the 4 surfaces and 2 ends. The surface of the phrenic surface, caudate nucleus, and lateral ventricles. That medial side, that is the third ventricle consists of the thalamus of opposite side to the interthalamic connection to the interthalamic action. Lateral of the posterior limb of the internal capsule. Inferior, that is the anteriorly hypothalamus, posteriorly subthalamus. This is the third ventricle. The anterior end, the form of projection is called the anterior tubercle of the thalamus, behind the intervertebral foramen. The second of the posterior end, that is the projection is called the palvular, which is above the superior caulicle of the lateral and medial canicular body, both of the lateral and medial. Internal structure, that external medial laminae and internal medullary laminae, that is connected to the lateral surface of the thalamus. They are separated by the reticular nucleus of the rest of the nucleus. It consists of thalamocorticals and the corticothalamic fibers. The internal medullary laminae, the bundle of the Y-shaped myelinated, that afferent and efferent fiber, divided the thalamus into the anterior, medial, lateral nucleus group of the. Each this group is subdivided into the number of named nucleus. That is the anterior nucleus, medial nuclear mass, and internal medial, lateral nuclear mass, and external medullary. You see the picture. The medial nucleus, that is the group of small nucleus situated by the medial surface of the thalamus of the near the midline. The internal laminar nucleus, that is internal laminar nucleus, smaller nucleus by the presence the medullary septum of the Thalamus, the medial mass nucleus. The nucleus situated medial to the septum and composed of the two nucleus, namely anterior nucleus and also medial nucleus. The lateral mass of the nucleus, the group of nucleus is situated at the lateral septum. The lateral mass nucleus again is divided into two subgroups, divided by the dorsal groups and of lateral mass and which two nucleus, and ventral group, that is lateral mass with the three nucleus. The posterior group nucleus divided into two subgroup, namely palvular and metathalamus, and metathalamus included the medial granular body of the lateral thalamic reticular nucleus. The thalamus is also included thalamic reticular nucleus, which is the thin layer of the numbers of covered by the lateral aspect of the thalamus, separated by a thalamus by the external medullary nucleus. It is receiving the information from the rectus formation and cortex in thalamus incubations of a thalamic nucleus. This is the anatomical classification of this nucleus. This is the anatomical classification. The midline nucleus, the afferent fibers connected from the globus pedicles, hypothalamus, lateral duct, hypothalamus, and the cerebral cortex, midbrain of nuclear reticulum. The efferent fiber differentiate from the cortex. Internal nucleus, interthalamus nuclear reticular formation, trigeminal laminae, lateral thalamus. Efferent fiber, the cerebral cortex, putamen, cauda nucleus, and other thalamus. Medial mass, that anterior nucleus, they have the mammillary body of afferent nerves and the limbic cortex of the efferent fibers. Dorsomedial nucleus, that is the afferent fiber of the hypothalamus, efferent fiber from the limbic cortex, putamen, caudata nucleus, and hypothalamus. The lateral mass nucleus, that is the posterior nucleus, ventral anterior nucleus, ventral lateral nucleus, and ventral posterior nucleus. That is the anterior fibers from the afferent fibers from the periasa cortex, parietal lobe, globular pedicule, globus pedicule, and renal nucleus and red nucleus, trigeminal nucleus and trigeminal laminae, and medial laminae, spinal thalamus. The efferent fibers of the lateral mass of the dorsal lateral nucleus have the peristernal cortex, lateral mass of posterior lateral nucleus, that is the parietal lobe, ventral anterior nucleus of the putamen, cauda nucleus, and the premotor cortex. The ventral lateral nucleus, that is found the putamen, cauda nucleus, and precentral cortex. The ventral posterior nucleus, that is the hypothalamus, and cerebral cortex. Area number 3, 1, 2, 5, and 7. The posterior group, the palvular group, medial genicular body, lateral genicular body. In the palvular group, that is inferior parietal lobe, occipital lobe, and the medullary body of the auditory tract, the lateral genicular body, that is the optic tract. The inferior parietal lobe, occipital lobe, auditory cortex, and the visual cortex. This is all the anatomical classification of thalamus. Going to the physiological classification, they connected the bond classification. This is based on the function of their projection of thalamus nucleus. That is the nucleus classified into 5 groups. They are the classified by called the Bongard classification. Therefore, the thalamic classification, thalamic radiator classification. The group of the nucleus have the specific sensory relations. The specific sensory relay nucleus, that nucleus have the ventral portion nucleus, medial genicular body, lateral genicular body. Function project the sensory signal to the distinct or the area of the cerebral cortex. The specific nucleus, that is the nucleus of the ventral anterior nucleus, ventral lateral nucleus. The function is receiving the signals of the controlling the motor activity of the cerebellum and the corpus tenatum, and sending this signal to the motor area in the cerebral cortex and the complex feedback system of the motor control. Association of the less specific nucleus, that is the dorsal nucleus of the associated less specific nucleus, that is the dorsal nucleus of the posterior nucleus or the palvary body. That is the function, the sending information associated area of the cerebral cortex. After the non-specific nucleus, that is the medial nucleus and internal nucleus, radiator nucleus. The project signal in different area of the cerebral cortex. Limbic systemic nucleus, the anterior nucleus, dorsal nucleus, project of the limbic cortex. These all the specific nucleus. This type of nucleus is called specific nucleus. All the specific nucleus have line with the ventral pride of the lateral nucleus group. The classification of thalamus. The three group each 4 nucleus for the 12 nucleus. See, this is the nucleus and afferent fibers, efferent fiber and the function. The place a posterior lateral ventral nucleus, the medial spinal laminae and the sensory cortex. The function receiving the sensory information of the pain, temperature and the touch of the whole body. The posterior medial ventricle nucleus, that is the trigeminal lamina, the receiving the sensory cortex, the receiving the sensory information of the pain, temperature and touch, face and the anterior part of the skull. The lateral germinal body, the optic tract, the optic radiata, visual tract, visual sensation, the medial and the lateral lamina, auditory tracts. Circuit of the Rayleigh nucleus. This receiving the impulse from the different of the central nervous system of the Rayleigh of the specific area of cerebral cortex. The lateral ventral nucleus and anterior ventral nucleus and anterior nucleus and part of the dorsal medial nucleus. The premotor circuit to the relay nucleus. They received an impulse from the different area of the central nervous system to relay the specific area of the cerebral cortex. That is the lateral ventricular nucleus, anterior ventricular nucleus, anterior nucleus, and the part of the dorsomedial nucleus. This is the thalamus. Anterior nucleus. The anterior thalamus radiator connected the frontal lobe of the cerebral cortex and the medial and lateral thalamus. Thalamus is connected the mostly motor nerve fibers. That is premotor fiber. The superior of the fibers is connected to the post-central gyrus of the parietal lobe and the adjacent area of the frontal cortex with the lateral mass of the thalamus nucleus. It consists of the mainly sensory fibers. And the posterior thalamic radiata predating the posterior thalamic radiata connected the lobe of the cerebral cortex and the pulmonary lateral gyrus. That is the posterior thalamic radiata also occipital lobe of the cerebral cortex with the pulmonary gland, the lateral body of the connection of the nerve fibers. That anterior nucleus, that is the functional association of the input is the mammillary body and hippocampus. How to say sigmolateral cortex. The medial nucleus group, the associated with the amyloid, olfactory cortex and the hippocampus. The output is the prefrontal cortex of the hippocampus. The lateral dorsal of the associated with the amygdala, the alpha cortex of the hippocampus. Lateral and posterior cortex, that is the association, the superior lateral posterior of the occipital portion of the temporal bone. The medial amylase, the specific nucleus of the inferior collicular and the auditory cortex. The lateral genia, the specific nucleus of the left and right eye. That means optic tract, the fire ray of the visual cortex. The posterior verular nucleus, the specific nucleus. The nucleus of the trithalamic tract, that is the somatosensory tract. The posterior ventral, the specific nucleus, the medial spinal thalamic tract, the primary functions of the sensory somatosensory cortex. The posterior nucleus of specific nucleus, superior and inferior collicular, the primary somatosensory. The ventrolateral nucleus, the specific nucleus, that is the Bulbous peduncle, the primary of the motor cortex. Ventral anterior nucleus, the specific nucleus, the bulbous peduncle, the primary motor cortex. Interlaminar nucleus, that is difference nucleus, the spinal cord, spinothalamus, reticular formation, cerebral nucleus, bulbous peduncle, the cerebral cortex and the sternum. The reticular nucleus, the different nucleus, the reticular formation of the corticothalamic tract and the dorsothalamic tract. These are the functional orientation of the thalamus. Again, the functionally thalamus, that is the rally center. The thalamus from the rally center of the sensation of the impulse to the almost all the sensation reaching the thalamic nucleus. The particularly ventricular posterior nucleus, the after being of the process of the thalamus. The impulse of the correctum cerebral cortex through the thalamo cortical fiber. The central for the processing of the sensory information. Thalamus from the forms the major center for the processing of the sensory information. All the particular sensory impulse reaching the thalamus integrated of the modified before path of the same specific area. The cerebral cortex functionally thalamus usually called the processing of the sensory information. The function of gate of the cerebral cortex. Almost the sensation of the processing of the thalamus means the reaching the cerebral cortex. Very little information of the somatosensory function, the short direction of the cerebral cortex without being the process of thalamic nucleus. Because of the function, the thalamus usually called functional gate of the cerebral cortex. Central determining quality of the sensation. Usually, the sensation of the two quality of the namely descriptive nature and affective nature. Descriptive nature is the ability to recognizing the type of localization and other detailed sensation, and is the function of the cerebral cortex. Affective nature, the affective nature, the capable determinant of the sensation, the pleasant of unpleasant and agreeable of the disagreeable, the determining of afferent nucleus of sensory function of the thalamus. The central of the sexual function, the thalamus is central sexual sensation. Role of the absolution and alternation of the reaction, because of is connected by the nucleus of reticular formations to the thalamus, play the important role of the alternate of the reaction. The central reflex activity is the same. Sensory reflection of the center mainly reflects action. Center of the integrating motor activities in the activity. This is the connection, the cerebral and basal ganglia of the thalamus, severe connection of internal motoric functions. There is the applied physiology of the thalamus. Thalamic lesion, thalamic syndrome. The thalamic lesion is occurs mainly because of the blockage due to the thrombosis. The blood vessels supplying the thalamus, mostly posterior ventral nucleus of the thalamus, are affected by the thalamo-genicular branches. The posterior cerebral artery supply the part of the thalamus. The lesion of thalamus lead to the connection of called thalamic syndrome. The thalamic syndrome, that is neurological disorder caused by the infraction of the posterior ventral part of the thalamus. This may be syndrome, thalamic syndrome. The thalamic syndrome is whole body become the hypersensitivity to the pain. Hypersensitivity to the pain and the loss of the sensation, astrogenesis in ataxia and thalamic phenomena claim. And the anosogenesis, spaso the pain thalamus, involuntary movement. That is the degenerative Raynaud syndrome, thalamic hypersensitivity as anesthesia, thalamic pain syndrome, central pain syndrome, central post-stroke pain syndrome, posterior thalamic syndrome, retrothalamic syndrome, and the involuntary movement, that is called athetosis and chorea and the internal tremor. Athetosis is the rougher, slow writing and twisting movement. Chorea is the meaning of quick and jerk involuntary movement. Internal tremor, that is called as the tremor is different rapidly alternate rhythm and the involuntary movement for the flexion and extension of the joints of the fingers and the wrist or elbow. The internal tremor of the tremor that develop the while attendant of any voluntary action. That intention tremor is common features of the thalamic syndrome. The thalamic hand and the alternating hand, the athetoid hand, that abnormal attitude of the hand, the thalamic lesion. They are characterized by the modern flexion at the wrist and the hyperextension to the all the finger. These are the syndromes of the thalamic syndromes. One more time, the thalamus, there are the involuntary movement that is called as athetosis, chorea, and the intentional tremor. Athetosis, that is called as the slow the writing and the twisting of the movement. Chorea is the means quick jerk, that involuntary movement, and the intentional tremor that you define rapidly alternate rhythm and the involuntary movement of the flexion and the extension of the joint of the fingers and the wrist or the elbow. In the intensity tremor, that is the tremor that develop the attitude to do any of the voluntary action. The involuntary tremor, the common features of the thalamic syndrome. This is the thalamus. Thank you.